Okay, so let us start with the another video, that is storage media. Kinda et al. 2017 has published an article on clinical and practical implications of storage media used for avulsed tooth. Okay, Kinda et al. 2017 clinical and practical implications of storage media used for avulsed tooth. So what they have told in their article, that ideal requirements for storage media, it should have antimicrobial property, it should preserve the PDL, viability of the PDL cell for an acceptable period of time, it should have same osmolality level as that of the body fluids, it should not react with the body fluids, no antigen antibody reaction should be there, it should have a good shelf life, it should decrease the risk of post implantation root resorption or ankylosis, and it should wash off the toxic products. Again I am saying antimicrobial property होना चाहिए, PDL cells को preserve कर पाए, या फिर PDL cells, it should be able to keep the viability of the PDL cells as we are storing the tooth in it. So for a longer, for at least an acceptable period of time, it should keep the PDL cells viable. It should have the osmolality level similar to that of our body fluid, so that there will be no antigen antibody reaction. It should not react with the body fluids. It should have a good shelf life, and when we are using the storage media, we basically want to reimplant the tooth, right? So we do not want any reimplantation complication due to the storage media. So it should decrease the risk of post implantation root resorption or ankylosis. It should wash off the toxic products from the tooth. Okay, now there are various storage media can be classified as physical media and non-physical media. Physiological media and non-physiological media. First we'll study about the non-physiological media. Coming on to the saline solution, it has got osmolarity level of 280 osmolarity per kg. I will call it as milliosm per kg. Okay, 280 milliosm per kg saline solution. It normal saline appears suitable for short term duration. Okay, it can only store the ankylosed tooth for 2 hours. However, it is potentially damaging if cells are stored longer than 2 hours. Okay, once again, saline solution 280 milliosm per kg. Normal saline appears suitable for 2 hours. If you keep more than 2 hours, it might not be suitable for the storage media of the ankylosed tooth. Next is the saliva. Saliva is not considered to be very ideal, but because it is easily available and always available, right? So we can use saliva. It can act as an interim storage media for avulsed tooth. 60 to 70 milliosm per kg. Okay, for saline it was 280, for saliva it is 60 to 70 milliosm per kg. It prevents desiccation. According to Wiens, patient's own saliva is the best media for best immediate media for tooth transport. Okay, according to Wiens, patient's own saliva is the best media for immediate transportation. Most recent studies have shown that saliva is not a great storage media for more than 1 hour. It's not a great media for more than 1 hour. Next is the pasteurized milk. It is considered to be one of the best non-physiological medium of storage media. It has got 270 milliosm per kg osmolarity. Saline has got more, 280. Pasteurized milk has 270 milliosm per kg. pH is 6.5 to 7.2. pH 6.5 to 7.2. Milk contains epithelial growth factors which stimulates the proliferation and regeneration of epithelial cells, rest of malaces, and activates the alveolar bone resorption. Okay. Milk के पास क्या होता है? It has got epithelial growth factor which will stimulate the proliferation as well as regeneration of the epithelial cell rest of malaces. Osmolarity 270 milliosm per kg and pH is 6.5 to 7.2. According to Patel et al., published in the Journal of Dental Trauma Guide, milk can be used as a storage media till 4 hours. According to Friedman, 6 hours can be tooth can be stored in the pasteurized milk for 6 hours. However, it cannot revive the degenerated cells. Next, we are coming to tap water. 30 milliosm per kg. pH is 7.4 to 7.9. That is more basic, right? Inadequate characteristics to be used as storage media. It does not have the characteristic to be used as a storage media. Bacterial contamination can be there in the tap water. So, and also it is hypotonic and non-physiological pH is there. It favors PDL cell lysis. But some studies have shown that we can still use tap water in cases where no other alternative is present. Next is the propolis. It contains resin, waxes, fatty acids, essential oils, and pollen proteins. Again, resin, waxes, fatty acids, essential oils, and pollen proteins. It is antiseptic, antibiotic, antifungal, antibacterial, antiviral, antioxidant. It has got immunologic properties. Therefore, according to Margaret et al., tooth can be stored in propolis and it has got highest PDL viability. Margaret et al. Told that it has got propolis has got highest PDL viability. Next is the egg white. Egg white is it has got high albumin content, that is it has got more protein. It contains vitamin, water, lack of bacterial contamination, and it is easily available. pH is 8.6 to 9.3. pH 8.6 to 9.3. Osmolarity is 258 osmolarity per kg. 258 milliosm per kg. According to Khademi et al., tooth can be stored in egg white for 6 to 8 hours. According to Khademi et al., tooth can be stored for 6 to 8 hours in egg white. Next is coconut water. It is the liquid endosperm of coconut. It is rich in amino acids, proteins, vitamins, and minerals. But according to Morera et al., pH of coconut water is 4.1, that is it is acidic. So it be deleterious to the cell metabolism and can cause cell metabolism. So according to Morera et al., the descending order for favorable tooth storage media is milk, then saline, then coconut water plus sodium bicarbonate. So it will make the pH basic, plus then coconut water and mineral water last. Now coming on to the oral rehydration salt liquids. According to Subramaniam et al. Concluded that oral rehydration salt liquid is as effective as HBSS to maintain the viability of the PDL cells and found better than milk. According to Subramaniam, oral rehydration salts were better than milk and as effective as HBSS. Now green tea extract, it can also be used as it has got antimicrobial property. Now next we will be studying about HBSS. HBSS, it is a physiologic medium, Hang's balance salt solution. It preserves the viability of the PDL cells. pH is 7.2. Osmolality 320 milliosmolarity per kg. 320 milliosmolarity per kg. Now what are its composition? It is best for preserving the vitality of the PDL cells. It has mostly the components which are responsible for maintaining the viability is the calcium, magnesium, and glucose. So it has got 8 gram per liter of sodium chloride, 0.4 gram of glucose, 0.4 gram of potassium chloride, 0.35 gram of sodium bicarbonate, 0.1 gram per liter of magnesium chloride, 0.14 gram per liter of calcium chloride. Again, 8 gram per liter sodium chloride, 0.4 gram of gram per liter of glucose, 0.4 gram per liter of potassium chloride, 0.35 gram per liter of sodium bicarbonate, 0.1 gram per liter of magnesium chloride, and 0.14 gram per liter calcium chloride. Okay. It is a good physiological medium. Hang's balance salt solution, preserves the vitality, pH 7.2, osmolarity 320 milliosm per kg. Now next is the Viaspan. It is considered to be the best medium, but it is very difficult in availability, and it is usually used for organ storage. So best physiological medium is the Viaspan, and the best non-physiological medium is considered to be pasteurized milk. Next is the Eagle's medium. Eagle's medium was less effective than the HBSS or milk, as concluded by Ashkenazi et al. Ashkenazi et al. Has concluded that Eagle's media less effective than milk and HBSS. Next is the Gatorade. Gatorade, it is the non-carbonated sport drink. pH is 3. Osmolarity 280 osmolarity per kg to 360 osmolarity per kg per liter. Next is the contact lens solution. It has got fatty acids, monoester, and cationic antimicrobial component. So because of the antimicrobial component, it can also be used as a storage media. Next is the tooth rescue box, that is DentoSafe. It can maintain the viability of the PDL cells up to 48 hours at room temperature. Next is the GC Tooth Mousse Plus. PDL cells, it can keep the PDL cells viable up to 60 minutes. It is a better storage media when compared to saliva, sodium fluoride, etc. So once again we'll just revise. According to Kinda et al. 2017, from the article Clinical and Practical Implications of Storage Media Used for Avulsed Tooth. Ideal requirements: antimicrobial होना चाहिए, preserve PDL, preserve the viability of the PDL cell. It should have the osmolarity similar to body fluids. It should not react with body fluid. Antigen antibody reaction नहीं होना चाहिए. Shelf life अच्छा होना चाहिए. Post implantation problems नहीं दिखाना चाहिए, and it should wash off the toxic products from the tooth. Can be classified as physiological medium, non-physiological medium. Non-physiological medium involves saline solution, osmolarity 280 milliosmolarity per kg. It is normal saline solution, suitable only for short term, that is for 2 hours. However, after 2 hours it is not a suitable media. Saliva, it is only it is used because it is easily available, and according to Wiens et al., patient's own saliva is the best immediate transport media. Osmolarity 60 to 70 osmolarity per kg. Pasteurized milk 270 milliosmolarity per kg, pH 6.5 to 7.2, one of the best physiological medium, contains epithelial growth factor, stimulates the regeneration of the epithelial cell rest of Malassez. According to Patel et al., milk in pasteurized milk, tooth can be stored for 6 hours. According to Friedman, tooth can be according to Patel, tooth can be stored for 4 hours in pasteurized milk, and according to Friedman, for up to 6 hours in the pasteurized milk. However, it cannot revive the degenerated cells. Next is the tap water. It causes PDL lysis, but it is only used because of its easy availability. 30 milliosmolarity, pH is 7.4 to 7.9. नेक्स्ट इज़ दी प्रोपोलिस. इट हैज़ गॉट मेनी एंटी माइक्रोबियल, एंटीबैक्टीरियल, एंटीवायरल, जितने भी एंटी होते हैं सब इसमें डाल देना प्रोपोलिस में. एंड इम्यूनोलॉजिकल प्रॉपर्टीज ऑल्सो इट इज़ हैविंग. अकॉर्डिंग टू मार्गरेट एट ऑल, इट इज़ वन ऑफ द बेस्ट इफेक्टिव मीडिया फॉर PDL viability. Then egg white, easily available, high albumin level, less bacterial contamination. 8.6 to 9.3 pH level, 258 milliosmolarity per kg. According to Khademi et al., up to 6 to 8 hours tooth can be stored in egg white. Coconut water, it was seen that it has got acidic pH, so when you add sodium bicarbonate, the pH can be maintained, and can be used as a good storage media. Oral rehydration salt solution. According to Subramaniam et al., it is one of the best media, as effective as HBSS and more effective than pasteurized milk. Green tea extract, antimicrobial property, can be used for which can be used for storage media. HBSS solution, physiological media, preserves the viability. 7.2 osmolarity, 320 milliosm per kg. Composition 8 gram per liter sodium chloride, 0.4 gram per liter glucose, 0.4 gram per liter potassium chloride, 0.35 gram per liter sodium bicarbonate, 0.1 gram per liter magnesium chloride, 0.14 gram per liter calcium chloride. One of the best non-physiological medium, physiological medium. Wirespan considered to be the best, but it is difficult in available, and it is usually used for organ transport. Then Eagles media, according to Ashkenazi et al., it is less effective than HBSS and milk. Gatorade, non-carbonated sport drink, pH is 3, osmolarity 280 milliosm per kg. Next is the contact lens solution. It has got fatty acids, plus it has got antimicrobial properties. Tooth rescue box can maintain the vitality up to 48 hours. GC tooth mousse plus PDL cells up to 60 minutes can be stored. It is better storage media when compared to saliva, sodium fluoride, etc. Now references I have taken from the from Kinda et al. Kinda et al. 2017 and Prashant et al. 2018 on influence of storage media and duration of fragment in the media on bond strength of the reattached tooth fragment from the Indian Journal of Clinical Pediatric Dentistry. Prashant et al. 2018, Indian Journal of Clinical Pediatric Dentistry. So I hope this storage media was clear. Many questions come from storage media. If you have any doubt, please post it in the comment section. I'll be happy to help you. Thank you so much.